Hi, my name is Heidi Carpenter, and I live in Tucson, Arizona. I started the graduate certificate for health law for health professionals in 2021. I was working at Banner Health at the time in home health, doing occupational therapy. That is my clinical training. And I really wanted to know more about the regulations and laws that were governing my clinical practice. I found that the University of Arizona College of Law had a partnership with Banner Health, and I enrolled in the courses. I really enjoyed the legal and regulatory fundamentals for healthcare business. I know that this might not sound very exciting right off the bat, but I promise you it gave me a whole new perspective into all of the regulations and the statutes and the laws that go into healthcare practice, which had been touched on when I was as a clinician, but as you know, we had a lot of other things to learn. So I now, 9 years into my practice, got to dive into more of the legal side of healthcare, which I have found to be really exciting. So I currently work at Huntington University. I am an assistant professor and academic fieldwork coordinator. So it's been fun to be a teacher, but then also a student going through this program. So I really wanted to learn and grow more in my profession. I really enjoy advocacy, patient advocacy, student advocacy. So as I got deeper into the graduate certificate, it ended up turning into a master's program. So I'm going to be graduating in the master's in legal studies this fall with a concentration in legal paraprofessionals. So I am really looking forward to that and how I'm going to bridge the clinical field of occupational therapy and the legal field of now this legal paraprofessional together. So I think that this program would benefit anybody who is curious about regulations or wants to move into maybe a non-clinical role or have a hybrid position where you still do some clinical, but then also maybe work on your quality team at a hospital or healthcare system or start your own business. I think that the two of those go really nicely together since healthcare is such a highly regulated field. I enjoyed the convenience of this program. It was all online and the courses were about 7.5 weeks. I enjoyed taking one course at a time and I moved through the program at a pretty good pace, part-time, of course. So I would access my courses online and the instructor would inevitably have us do a discussion group at the beginning of the class. And I found out there were people all over the world taking these courses in various different fields. I found some other clinicians in these programs as well as non-clinicians. And so the networking available is also a really great benefit. I enjoyed the teacher feedback and the teacher assistant feedback throughout the courses. Everybody was available to answer questions. They held Zoom office hours. And so that accessibility and feedback really helped me learn through the program. If you have any interest in biomedical informatics, I highly recommend Law 577, Introduction to Biomedical Informatics with Dr. Vanish Subian. And that class really opened my eyes to the potential of, again, how law and clinical expertise can come together to provide better care for the clients we serve.